I'm Dr. Charles Ruotolo, orthopedic surgeon, president of Total Orthopedics and Sports Medicine, and today I'll be talking about your post-operative recovery after ACL reconstruction. Just to go over your recovery at a glance, one is you're going to be wearing a brace after surgery. You're going to be using a Cryocuff or ice for swelling. You're going to be doing quad sets daily to get your quadricep muscle firing, and you're going to be starting therapy early on. Just to go over each one here. Now, as far as your brace goes, I'd like you to wear your brace at all times for the first 2 weeks, including when sleeping. It's okay to remove the brace for showering, though it's helpful to be using a shower chair. Certainly you don't want to fall over or slip in the shower. Besides that, it's also okay to remove the brace for physical therapy, though that should be when the therapist might be manipulating your knee. If you're doing any walking, the brace should be on and the brace should be locked straight. It's also important that when you're sleeping, you lock the brace straight, as it is hard to get full extension that first week after surgery. And sleeping with your leg locked straight just helps you set you up for the next day so that you're not working on trying to get your leg straight after sleeping with it bent all night long. As far as ice or Cryocuff, there's two different ways that you can ice your knee. Certainly a standard ice pack is one of them. If you're going to use that, I'd like you to do it a half hour on, half hour off the first day after surgery and do that continuously all day long until about 11 o'clock at night. After day one, it's at least 3 times a day, though if you love the ice, you can ice every other half hour all day long. If you're using a Cryocuff or what we call the ice machine, which is a pad that'll go around your knee, you can use that continuously the first day until about 11 o'clock at night. And then after that, if you're still using it, a half hour on, half hour off. And the same thing goes for the next 2 weeks. I'd like you using that ice or the Cryocuff, half hour on, half hour off, at least 3 times a day. As far as pain medication goes, we do a multimodal thing for pain medication. So one, you're going to be taking Tylenol. Tylenol is 650 milligrams. You're going to take that every 6 hours, and you'll start that as soon as you get home after surgery. You're also going to be taking Genarvix. Genarvix is a newer pain medication. It's a non-narcotic. It doesn't enter your brain, doesn't make you constipated, though it's as strong as oxycodone. So you're going to take 2 of those in the morning prior to surgery with a small sip of water as a loading dose. And then you're going to take 1 every 12 hours after that. That first one you're going to have on an empty stomach, but then after that, you can eat after taking it. And you're going to continue to take that for the first 2 weeks. And then besides that, you can also take oxycodone, which you take as needed for pain. Usually I see you the day after surgery. During that time period, we'll do a dressing change. You'll be able to shower after I see. You'll also get set up to start physical therapy. Usually physical therapy starts a couple days out once you get your pain well controlled. Physical therapy in the beginning will start on range of motion, especially working on full extension. And the last thing I want you doing after surgery is taking a baby aspirin once a day, which helps prevent blood clots. As far as isometric quad strengthening, which you'll do starting the first day after surgery, you're going to put something underneath your ankle, nothing behind your knee. You can do this even with the brace on. And you're going to try and tighten your quadricep muscle as you're pushing your knee down into full extension. You're going to do this for 2 seconds, and you'll do that for 20 repetitions. So you do 4 sets of 20, and I want you doing this twice a day. Your goal is to get that quadricep muscle firing so that you can easily lift your leg. And right after ACL surgery, that muscle turns off. So this is an important exercise. Get that muscle firing and also get your leg to go into full extension. These are all the instructions you have after ACL surgery, though certainly we'll see you after ACL surgery. Typically, we see you the day after surgery, and then we see you frequently after that to make sure that you're doing everything correctly, because your recovery is our priority.